Hello and welcome to HealthDay Now. I'm Mabel, Jong. It's confusing when your doctors, the people you've been conditioned to trust, doubt the painful symptoms you're describing. And then what's worse, when you start doubting them yourself. Welcome to medical gaslighting, an unfortunately common occurrence which leaves patients, especially women, feeling dismissed. If you have some form of chronic illness like endometriosis, which is both invisible and classed as a woman's disease, you may have experienced medical gaslighting in some form. I'm so fortunate to have two guests with me now to share their experiences and expertise. April Summerford is a podcast host and owner of Women's Health Leadership, a health and wellness coaching business based in California. And Dr. Christine Metz, researcher at the Feinstein Institutes at Northwell Health in New York. She also co-directs the ROSE study, which is seeking better treatment for endo patients. Welcome to you both.
Thank you.
Thank you for having us.
April, let's start with you. You first started experiencing chronic pain in your teens, crampy and extremely painful periods. What did it feel like working with doctors, trying to figure out what was going on?
Well, as you can imagine, when you're a teen, it's embarrassing, it's frustrating. It's really difficult to know what's going on. The history of pain in my family goes back so far that my mom didn't really bother to even say, like, let's go to the doctor, because she had never received help herself on her journey. So by the time I got to talk to my own doctor, which I remember being really excited to talk to a female OBGYN on purpose, I thought, okay, I'm going to go talk to a female doctor. She's going to listen to me. We'll have a conversation. And she had a pretty similar answer. She's like, well, you're a woman. And so that means, periods are painful. And so there's not a lot we can do. So I went to her for about 10 years, and it was a very long time before I ever got a diagnosis of endometriosis.
Wow. You were told that pain is normal for women, even by your doctor.
Yes.
Did that make you doubt what you were feeling? What other examples of gaslighting did you experience?
I don't know if at first it made me doubt what I was feeling. It was, when you go to an authority figure, like you were saying earlier, your doctor, right? Someone who's experienced, they have training, you're trusting them, and they tell you, well, this is going to be normal. You're like, okay, well, that's not helpful, but also, I know I'm still in a lot of pain. So I got to find something to help me with this. That was the first experience I had of medical gaslighting. The second time was actually after I had diagnosis, which I was very pleased to be diagnosed with endometriosis, because then at least I had a term for what I was dealing with and what I was experiencing. But the doctor that I had do the diagnosis did not treat the disease properly. He used cutlery and a burning iron. So he burned tissue further into my pelvis instead of removing those lesions. And so the second time was actually after that surgery. I told him, well, I actually feel worse. So it's great that you told me what I'm dealing with, but I don't feel any better. I feel worse. And he was like, well, here's some drugs and, you'll be on your way. I did the best I could, kind of a thing. And so he dismissed me as well, not telling me, that he hadn't gotten all the disease out and that there were other ways of managing the disease.
Yeah. I want to talk more about that second time. But first, Dr. Metz, lots of us Google symptoms all the time. Why is gaslighting still happening?
It's really a sad concept. I mean, clearly it's an emotional abusive strategy that patients begin to question their own symptoms and their own thoughts about how they're feeling and their own sanity. And gaslighting in women's health actually seems to be on the rise. This may be due in part to increased knowledge of the concept of gaslighting, but regardless, it is inappropriate. It is linked to poor patient outcomes, and it really has to be stopped.
Now, we keep talking about this happening to women. Why to women? And are we also seeing women of color specifically experiencing this? Lots of times women are diagnosed and treated differently by doctors than men, even though they might have the same health conditions. Why?
That's it. And it's true. There was a survey in 2019 that said that 17% of women felt that they were treated differently in healthcare because of their gender, compared to only 6% of men. And it does seem that gaslighting in the women's healthcare field seems to affect women more. I believe women of color are also experiencing serious consequences, but also other vulnerable groups. I think teens and preteens, as April said, and even those with disability, are just not taken seriously when they describe symptoms to a physician. And we just have to keep working to provide equitable care for everybody. Regardless of who you are, it shouldn't be the determinant of how you're treated. The treatment should be based on your symptoms and your medical workup.
April, we're talking about a medical workup that led to maybe perhaps the wrong path for you when you did get that diagnosis and then you got treatment. Tell me what happened at that point.
Yeah. So the first doctor I saw for a very long time eventually had a scan done. It's kind of amazing to me. It took that long for her to have me have an ultrasound scan, but we did an ultrasound. She thought she saw something abnormal on one of my ovaries. And then all of a sudden she was like, well, I didn't want to say this, but I think maybe you're struggling with endometriosis. And so she referred me to a local OBGYN who called himself a specialist, an endo specialist. However, he was using outdated treatment methods. So he did give me the surgery. It's a diagnostic laparoscopy. However, he used, like I said, inappropriate treatment methods for the disease. So as soon as I met with a true specialist, he was like looking at my pictures thinking, well, of course you're still in pain. You have all these lesions burned into your tissue. And he was kind of concerned about one of my fallopian tubes and said, well, we need to like really make sure he didn't do damage.
And at that point, how many years had gone by?
Took me about 3 years from the first doctor. At least that was a little bit shorter. But the problem with this problem in general is that women are experiencing 10 years delay in diagnosis, then another 3 years delay of proper, treatment, plus another 5 years of something. Like it just ends up being this very long journey that doesn't need to be this long.
Is there a gender bias in research that may be at the root of all of this?
Absolutely. I do believe that there has been gender bias in research funding, and many female diseases, or those that affect women predominantly or more than men, appear to receive fewer federal research dollars when compared to conditions that affect primarily men. So for example, endometriosis affects approximately 10% of females of reproductive age, and over the past 14 years received $176 million in research funding from the NIH. By contrast, hepatitis, which affects about 1% of the population in the US, but with more men affected, has actually received $4 billion from the NIH.
Wow.
Interestingly, the federal government, the NIH, has awarded 3 times more research dollars for a condition known as smallpox, which has been eradicated from this earth since 1980 in the past 14 years than endo. 3 times more funding.
Wow.
So I don't suggest we defund research on important diseases, but there is clearly a need to increase research dollars for women's health.
What is the advice you would give your younger self?
I wish that I could tell my younger self, like, you're going to have intuition about your body and where to go for help, and you should listen to it. You should not argue with yourself. You should just go do it, whatever that is, that intuition hit is. I'd also tell her that you know a heck of a lot more about your body than you think you do, or that anyone else tells you do. And you should tune into that and completely honestly trust yourself. And then I think the third thing would be, like, when you find someone like that who doesn't listen to you or isn't providing help, don't waste any time. Oh my gosh, if I could take back that first 10 years, I would.
Okay. Dr. Metz, what strategies should patients keep in mind when seeking help? Should the emotion be kept out of it when you're describing your symptoms?
So I kind of agree with what April said. I think women know a lot more about their bodies than they think they know. And I think the patients need to follow their symptoms and their instincts, and just clearly articulate what those are. sometimes I recommend to patients to have things written down, what they want to cover with their physician. Because if it's written down, you have a little checklist and you can go through it. Because if you experience being dismissed, you don't become emotional about it and shut down, but rather continue on your list. And if healthcare providers don't listen to you, as April felt, and I hear this repeatedly, and your response to concerns aren't what you're expecting, it's time to find another one. And just like April said, I think women need to follow their instincts. Even if someone has told you this is the best doctor in this area, if you don't feel you're getting the treatment you deserve or feel you need based on your symptoms, you have to move on. And severe period pain is not normal.
Mhm.
All right. April Summerford, thank you so much. April Summerford, podcast host and owner of Women's Health Leadership. And also our thanks to Dr. Christine Metz, researcher at the Feinstein Institutes of Northwell Health. Thank you to you both.
Thank you.
Thank you.
And I'm Mabel Jong. You've been watching Health Day Now.